Hi, my name is Bill Leland. I am the Internal Medicine Program Director at ECU Vidant, and glad that you're here and glad that you're going to be evaluating our program, looking at it and see if you think it would be a good fit for working with us. I've been in Eastern North Carolina since 1995. I grew up in San Juan, Puerto Rico, and went to med school at Chapel Hill, and did my residency in Texas and did a GI fellowship at Vanderbilt, and have thoroughly enjoyed living and working in Eastern North Carolina. I live and work in this region because I enjoy the people I take care of, and I enjoy the people I work with. And when you finish here, you'll be trained not only in the ability to take care of just about anybody you want to take care of, we also have a lot of opportunity for you to learn about wellness, about leadership, about quality, about a lot of other things that will help you grow in your ability to be an outstanding physician. I'd like to stress that Eastern North Carolina is a great community. It's a place where people will know you and you'll know them. It's a community that welcomes people from all around the world, and it's a community that I think you'll find a great home, and look forward to meeting you in virtual person, and look forward to the years ahead and our ability to train physicians to become leaders of the future.
I think one of the biggest initial draw of the program, and what's really rung true throughout my time here, has been the people and the culture. From the first time I came here during the pre-interview dinner, I saw the camaraderie amongst the residents. I saw the laid-back nature, and I really saw myself fitting in here. And that's really been the case since I've been here. I have a great working relationship with all of my colleagues, and that's not only amongst our class, but really the class above us, the class below us. We all get along and work well together, not just inside the hospital. We have a group that plays soccer. I have some folks that I play basketball with. We hang outside of the hospital together. So having that familial atmosphere here has really been personally important for me, and it's something that I really value. And that extends to our faculty and our leadership as well. I've never really felt intimidated or scared to approach an attending. Leadership has always been approachable as well. They really value our opinion, and that's something I've always appreciated. So my biggest takeaway here is that honestly, I couldn't be happier to have ended up here just because of the tremendous culture that we have here. So good luck with the interview process, and I hope to meet some of you all during the virtual interview season.
So this is my 4th month of residency, and I think some of the things I've loved so far at ECU is just being able to work so closely and collaboratively with attendings. I think even in my 4th month, I've already noticed so many changes in the way I approach patient care, and they've really pushed me to challenge myself in the way I think, broaden my differentials, and even senior residents have been so supportive and involved in my learning, always teaching me, and also giving me autonomy, even though I'm in my 4th month. So I think that's really been helpful. Something else that I think I didn't realize until I came to ECU is a lot of programs talk about wellness and just resident mental health. I feel like at ECU, that's already integrated in the curriculum. We get early sign out when we're on general internal medicine floors, and seniors are really good about noticing when we're tired or we're burning out. And even in the ICU, I've lost a lot of patients this week, and about 4 to 5 seniors have come in to check in with me and make sure that I'm doing okay. And that's just been my experience so far, and I'm really excited to see what the rest of my 2 years of residency have for me.
Originally grew up in Wilson, North Carolina, so I was familiar with ECU growing up, and Vidant as well. However, one thing that pleasantly shocked me whenever I was applying to residency here, attending the interviews, and after being in residency, is just how diverse the program actually is. You know, are able to meet a lot of different types of people, get to experience different cultures, and then have the pleasure of treating patients who are in, you know, these cultures as well. And you get the opportunity to learn from these experiences. All of the staff here is super approachable, super you know, willing to go out of their way to teach you. And I think that's also another thing that's really good about this program. The nursing support staff, the, you know, environmental staff, every single staff member that's, you know, affiliated with this hospital has an integral role in your residency. And it actually really helps us out as residents because we're able to focus on our patients rather than focusing on other, you know, smaller details of like the, you know, patient care. So I think that's one thing that, you know, coming from doing my clinical rotations in New York back to North Carolina, that I appreciate. You know, you're not doing all this, you know, quote unquote scut work. This program is an amazing program. Welcome to the residency interview.
The strong suits of our program that I might be biased, but I'm very proud of, is our clinic. Because our mission is to serve an underserved population in Eastern North Carolina, there are a lot of chronic diseases that we face. And so I think one of the biggest parts of that mission is to work on prevention and primary care. And so we have a really good clinic set up that you'll be a part of in the continuity clinic and also during ambulatory blocks. So you'll get a good exposure to the clinic setting. You'll get to work with support staff that includes referral coordinators, health coaches, dietitians, and we have a diabetes specialist, a chronic kidney disease specialist. There's a lot of information that you can pick up from the different attendings that you work with, who are all very open to spending time with you to learn how to manage a clinic encounter, work with the electronic medical records. As we face this new challenge of working with telehealth, we've tried to use that as an opportunity to connect with our patients better, with more regularity, and that's something that you'll get an opportunity to experience and hone your skills with